And now to Gabon, where hundreds of people recently gathered in Libreville for the first edition of the New York Forum Africa, the group including decision makers, entrepreneurs, and experts from various fields. Organized by Richard Atias and Associate in partnership with the government of Gabon, the forum provided 3 days of discussions and high-level plenary sessions focusing on key economic and business issues confronting Africa. Health was also on the agenda as the participants discussed the right health system for Africa. And during the forum, I had an opportunity to speak with Nzouba, the health minister of Gabon, and he discussed some of the priorities on the ministry's agenda.
Le master plan établi par le chef de l'État.
According to the President's master plan, the landscape of health in Gabon has 3 main sectors in terms of facilities. The tertiary sector that include the teaching hospitals, the secondary sector that include the regional health centers like the one in Franceville, Port-Gentil and Libreville, and the primary sector that include dispensaries and smaller health centers. In this regard, the main projects in Libreville are 4 teaching hospitals that are in construction and 1 has been completed. In Lambaréné, the Albert Schweitzer Teaching Hospital is being built and will be inaugurated during the centennial of Schweitzer in Gabon. With regards to treatment and care, one of the priorities that were instructed by the President is mother and child coverage, precisely the fight against child and maternal mortality, which are the Millennium Development Goals 4 and 5.
What are you doing with regards to these Millennium Development Goals 4 and 5 that you just mentioned? What is the country doing, or the ministry doing?
À ce niveau, un plan stratégique est mis en place.
A strategic plan has been established, first in Libreville because most of the population of Gabon lives in the city and of course in other parts of the country. This plan includes an upgrade in the capital city of all the mother and child care centers, or PMI, which has already started. It also includes upgrading the different surgical medical centers to increase their capacity with hospitalization and delivery beds. This will enable the mother to deliver conveniently in the center, and she would only need to go to the main hospital if there is a complication with her delivery. Secondly, if there is unfortunately a maternal or infant death, we will identify and address the root cause of the death in an effort to prevent future ones. We are also reviewing our immunization standards. Vaccination is very important, and 90% of children in Gabon are vaccinated. Furthermore, we are partnering with other sectors, including agriculture, education, and energy, to fight malnutrition and establish rigorous hygiene standards, because all these elements are instrumental for good health.
Contre la malnutrition et mettre des mesures d'hygiène rigoureuses.
Now, we know that Gabon has a population of about 1.5 million inhabitants. How many people, or what is the percentage of people that are covered in terms of health insurance?
L'offre de soins qui existait déjà depuis longtemps, qui a périclité un tout petit peu.
The health coverage that has existed already, but was a little bit on the decline, has been revamped with the President's master plan and will see a tremendous improvement in the coming years. We will be able to conduct surgeries in Gabon as if we were in Paris or New York and receive quality care as in Washington. Secondly, regarding access to treatment, there is the National Health Insurance and Social Security Fund, SINAM-GS. We do believe that with the political will, which is already in place considering the establishment of SINAM-GS, and the will of the people of Gabon to understand that it is free to subscribe to SINAM-GS, it will enable anyone to have access to care with 80% coverage.
Now let's talk about HIV/AIDS, an important issue today globally. Could you please tell us how it affects the population in Gabon and how it's being addressed?
La séroprévalence du VIH/SIDA est de l'ordre de 5,2%. C'est énorme.
5.2% of the population of Gabon is infected with HIV/AIDS, which is enormous for a population of 1.5 million inhabitants. even dramatic. This is why the president has made some important decisions, including the gratuity of ARVs, the gratuity of checkups covered by SINAM-GS, the creation of HIV/AIDS treatment centers. It is dramatic indeed for African countries and for Gabon. People get infected in many ways, including during procreation. This is why the First Lady, who is very much concerned and with the support of her husband, is particularly involved in the fight against HIV/AIDS through her NGO, the Sylvia Bongo Ondimba Foundation. She is at the forefront of the struggle and is spreading the word about the importance of prevention, among other things. I believe the Gabonese people are becoming more and more aware of the need to prevent themselves against HIV/AIDS. At the Ministry of Health, we are scaling up our prevention effort with the hope that HIV/AIDS prevalence in the country would decrease to 1 to 2%.
And that's all for today.
Well, Linord,
great.
Thank you. Thank you very much. It was a great interview.
Thank you.
And for viewers, be sure to watch Linord Moudou's Africa Health Network reports every Tuesday and Thursday right here on In Focus.